another tutorial of the super simple Axex Dental software. Today we're going to be discussing another element on the charts section of our software, and that chart can be easily accessed right here by the chart button at the navigation area on the top that will take you to the last patient that you saw. You may also search over here on the bar for a patient and click on that patient to be taken there. You may also look at the most recent patients right here in this drop down, and finally you can select the patient's appointment and then click on chart to be taken to that patient's chart. Today we're going to be discussing the fast chart section of our software. There's some other videos that explain this software in a more advertising way, but we will work today on discussing this one, especially when it comes to using it with a mouse and a keyboard. The other one explains how to use it with on a tablet. So this is the tooth chart section of our software, and this includes both the extraoral exam and the perio chart. So by clicking over here on a tooth, we're able to see that patient's tooth. You can select either to look at the primary permanent dentition or primary dentition as you wish to see it. And then you can select a tooth that you want to work with. So let's select a tooth right here, and let's say that we want to mark this tooth as already extracted. With 2 fingers, I can swipe from the root of the tooth out to the crown to mark it as already being extracted. That's right-clicking on a computer. If I want to mark it as it needs to be extracted, left-clicking from the root to the crown will allow you to do that as well. So that's how you mark an extraction. To mark different procedures that need to be done, once again, left click on the surfaces that you want. You can click and drag, or you may click each individual section separately. And as you can see right here, it shows you those areas that have been marked. For things that are already present on the tooth, you can right click on the section and it will immediately give you the option to enter the information that you need right there, in this case an inlay made in gold. And so it will once again notify you over here on the left hand side as to what's going on. You can always hit edit, and then you can view what are those areas, and you can unselect them and then click edit again to make it so that you can continue working on that tooth. Some of the other features include the selection of the crown. And you may right click on it to show something that is already present there. Let's say a porcelain, and it's going to ask me what kind of porcelain crown is there, and then notify me what's going on over here. In addition to that, we also have some additional options by tapping on the tooth. Once again, left or right click for items that are present or things that need to be completed. This person wants an implant over here, and I'm going to select it from that menu. So we have all of those options right there. This tells you what number the tooth is, of course the picture of what it looks like. Then you may click right here on the bar. It says slide, but it's not necessary to slide. Clicking is enough to move it up or down so that you can see the maxillary or the mandible teeth as they appear inside the mouth. Also, if you are wanting to work from this, my wife I know likes to see the chart as she's working on a patient. You can hit hide tray, and this will allow you to see the whole mouth at a glance, and be able to see what needs to be done on the patient or what is present. Show tray right here will bring it back up, and you can continue editing on this too. Next, let's discuss the perio charting. No exams are found. We're going to create a new exam. And from right here on the bottom, you can see the teeth that you are available to select from. You just keep scrolling. It will show you eventually the entire dentature of that patient. Let's select a tooth, and this will allow you to start from whenever you want. Let's select a tooth. Let's select tooth number 1. And over here on the top left corner, you will see on which side of the mouth you're working on, in this case the buccal or facial, and you can select also the lingual. You can enter the depth right here. You can either do it by entering on the keyboard or by entering on the keys provided right here. As you can see, it marks anything above a 3 already as bleeding. You can also mark recession. And it will automatically calculate the MGJ for you. You can also mark if there's a furcation, and as you can see, it has taken these numbers away since there's only a certain amount that you can mark, and you can also mark the mobility of that tooth right in this area. If there's an additional situation that needs to be marked on that tooth, you can also add it right here by clicking on the tooth and then clicking on one of these additional conditions of that tooth. And finally, you can add some notes over here or view the overview of the mouth in this chart right here. If you're using a tablet, you may also be able to swipe back and forth from side to side to advance from one tooth to the other, or you can always just simply click down on the tooth below. Here is a quick explanation of what things can be selected, and a little extra help if you ever find yourself that you need some more information. In addition to that, we also have the intraoral, extraoral exam, and this will be the area where you will add information about the gingivitis, tonsils, etc. And you can select yes or no to each one of them, and if you have a note on that particular one, you can enter it by selecting right here. And as always, you're welcome to contact us either by calling us toll-free at 855-GET-AXES, or simply selecting the Chat Now button from your Axex Dental software.